Rykindo 50 mg per 2 ml intramuscular suspension is a medication used to treat certain mental and mood disorders, such as schizophrenia and bipolar disorder. It helps to improve your ability to think clearly and participate in daily activities. This medication falls into the category of atypical antipsychotics and works by restoring the balance of certain natural substances in the brain. The recommended dosage and timing for taking Rykindo should be determined by a healthcare professional based on individual needs and medical history. This medication is administered through an injection into a muscle, typically in the upper arm or buttocks, by a healthcare professional. Your doctor will determine the frequency of the injections, which is usually once every 2 weeks. To minimize injection site irritation, the injections will be alternated between the left and right side with each dose. It may take at least 3 weeks for the medication to start working, so your doctor may instruct you to take another medication by mouth during this initial period. The dosage will be based on your medical condition, response to treatment, and any other medications you may be taking. Be sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to receive this medication regularly to maximize its benefits. To help you remember, mark your calendar to keep track of when to receive the next dose. Even if you feel well, continue to receive this medication as prescribed. If your condition persists or worsens, be sure to inform your doctor. Some common side effects of Rykindo 50 mg per 2 ml intramuscular suspension extended-release antipsychotics may include drowsiness, dizziness, lightheadedness, constipation, tiredness, drooling, weight gain, or redness/swelling/pain at the injection site. Dizziness and lightheadedness can increase the risk of falling, so it's important to get up slowly when rising from a sitting or lying position. This medication may also cause a rise in blood sugar, which can worsen diabetes, and may lead to significant weight gain and a rise in blood cholesterol levels. It can also increase the risk for developing heart disease. Additionally, it may rarely cause a condition known as tardive dyskinesia, which may be permanent. For females, an increase in a certain natural substance may result in unwanted breast milk, missed/stopped periods, or difficulty becoming pregnant. For males, it may result in decreased sexual ability, inability to produce sperm, or enlarged breasts. Rarely, it may cause a very serious condition called neuroleptic malignant syndrome. If you experience any severe side effects, such as severe dizziness, fainting, seizures, or a painful or prolonged erection lasting 4 or more hours, it's important to seek medical help immediately. A very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, seek medical help right away. Remember, this is not a complete list of possible side effects, so if you notice other effects, contact your doctor or pharmacist. As for Rykindo 50 mg per 2 ml intramuscular suspension extended-release antipsychotics, excluding select aripiprazole formulations, it is important to note that older adults with dementia may have a slightly increased risk of serious, possibly fatal side effects, such as stroke, heart failure, fast/irregular heartbeat, and pneumonia when using this medication. It is not approved for the treatment of dementia-related behavior problems. It is crucial to discuss the risks and benefits of this medication with your doctor, as well as explore other effective and possibly safer treatments for dementia-related behavior problems. It is important to follow the prescribed dosage and take it at the recommended time as advised by the doctor. Before taking Rykindo, make sure to inform your doctor about any allergies you have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor, especially if you have conditions such as liver or kidney disease, seizures, difficulty swallowing, low white blood cell count, Parkinson's disease, dementia, eye problems, diabetes, heart disease, high cholesterol, or breathing trouble during sleep. Rykindo may affect the heart rhythm and can cause symptoms such as fast or irregular heartbeat and dizziness, so it's important to inform your doctor about any heart problems you have or any medications you are currently taking. Additionally, low levels of potassium or magnesium in the blood can increase the risk of heart rhythm issues, so be sure to talk to your doctor about using Rykindo safely if you have conditions such as severe sweating, diarrhea, or vomiting. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery until you know how Rykindo affects you. Before undergoing any surgery, including eye surgery, make sure to inform your doctor about your use of Rykindo. Rykindo may make you sweat less, putting you at risk for heat stroke. It's important to avoid overheating, especially in hot weather, and to stay hydrated. Older adults may be more sensitive to the side effects of this medication, and pregnant or breastfeeding women should discuss the risks and benefits with their doctor before taking Rykindo. If you have any concerns or experience any unusual symptoms while taking Rykindo, be sure to consult with your doctor. It's important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This medication may interact with other drugs, such as metoclopramide, or products that cause drowsiness, including opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to inform your doctor or pharmacist if you are taking any of these products. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's important to ask your pharmacist about using these products safely. If someone has taken too much Rykindo and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness or dizziness, fast or irregular heartbeat, and unusual or uncontrolled movements, including seizures. It is important to have regular medical tests while using Rykindo 50 mg per 2 ml intramuscular suspension extended-release antipsychotics. This may include tests for blood sugar, weight, blood pressure, and blood cholesterol/triglyceride levels. It is important to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Rykindo 50 mg per 2 ml intramuscular suspension extended-release antipsychotics, excluding select aripiprazole formulations, as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule as soon as possible. This medication is administered in a medical facility and will not be kept at home. It is used to treat certain mental/mood disorders and is given as an injection into a muscle by a healthcare professional. The dosage and frequency will be determined by your doctor based on your medical condition and response to treatment. This medication is generally given once every 4 weeks. It is important to receive this medication on a regular schedule as directed by your doctor. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.